Today on Talking Solutions, we've got a return guest welcoming back Andres Ramirez.
Good morning. Thank you for having me back.
You're with the Ramirez Group, right?
Yes.
Nevada Health Link. I was on the website, and they were talking about navigator organizations. I'm thinking you're probably a navigator organization. You're the person who understands it, and you're going to help us understand it as well.
Terry, Ramirez Group was a navigator for the first two open enrollment periods of Nevada Health Link. This third open enrollment, we are now outreach consultants for the Nevada Health Link. So we are working with other navigators and Nevada Health Link to ensure that we reach as many people as possible to get enrolled in the process. First, let's talk about what a navigator is, because it is important. When the Affordable Care Act was passed, it was primarily intended to enroll consumers who don't have any health insurance, and largely people who hadn't been able to enroll on their own. And so since there would be a learning curve with how does this work, what is a copay, what is co-insurance, what is a deductible, what does this mean, they wanted to create entities to help consumers navigate the process. And that's where the term navigator came from. Can we find entities that will help consumers navigate this wide array of new healthcare options that the Affordable Care Act produced?
What's the cost? Can I get subsidies? Who do I go to see? There are so many options out there that, especially if you haven't had health coverage in the past, when something like that is overwhelming with me, I just freeze up. I don't do anything because I don't know where to start.
It's a common approach for lots of people, and so they wanted to give consumers some ease and some confidence to say, we're going to certify individuals to help you with this process. Along with brokers and agents, obviously, we have licensed brokers who are health insurance experts that could enroll individuals and consumers. Brokers and agents enroll a majority of the consumers into the state exchanges and Nevada Health Link. So we want to make sure there's a process that consumers can go and get in-person assistance with someone who understands the process, understands the terminology, and can help consumers make the right choice for themselves or for them and their families.
That would make me feel a lot calmer. Because there are so many options out there, and when we talk about it being overwhelming in a lot of cases, to sit down with somebody who really understands, and that person would say, it's not as difficult as you're thinking. I'll take you by the hand. I'll take you through this process. It's not that hard.
Absolutely. The other thing I do want to make sure that we mention on this program is that whenever you have one of these new programs, specifically targeting people to enroll in something they don't know a whole lot of information about, or maybe they do, but they're just still intimidated by the process, you're going to have some outside entities try and take advantage of the situation. So you will have websites set up like Obamacare plans or this, that, and the other. And these are people who aren't licensed, certified through the state exchanges or Nevada Health Link, who are trying to deceive people. And so people can be taken advantage if they don't pay attention. That's why it's so important to have entities like navigators and to have a process like the Nevada Health Link has, in which they certify and license agents and brokers so that the consumer knows, hey, here are trusted sources you can go to for information. And first of all, no one should be charging you to help you. There should be no cost, whether it's a navigator or an insurance broker, who should be charging you as a consumer any money to enroll in a plan. That's first of all. Second of all, there are processes. Every navigator and or agent, insurance broker who has been approved to participate has an identification card. And that identification card has their license number and a barcode on it that a consumer can look them up to ensure they are who they say they are. More importantly, those licensed professionals are required to carry their license with them whenever they're doing enrollment. So as a consumer, if you're unsure of who you're dealing with, or you're not sure whether this person is credible, you can always ask, can I see your Nevada Health Link ID card, or can I have your license number to look you up on the Division of Insurance website? And there are just some common practical tips that consumers can take to ensure that they're not being taken advantage of, or that someone's not going to do something inadvertently with their information.
Andres has pulled out his card, and I'm looking at it right here in the studio. It does say right on top, Nevada Health Link. It's an official card. Don't ever feel bad when you're talking with somebody about insurance plans and information that you're learning from them, and they're trying to get you signed up. Say, I need to see your Nevada Health Link card, if you would please. Nevada Health Link is the website where you can get all kinds of information. Also, from what I understand, you absolutely need to go through Nevada Health Link if you're going to get subsidies to help you pay for whatever insurance plan you end up getting.
Correct, or any type of government assistance, whether it's co-insurance. So if you want to ensure that you are getting into a qualified health plan through healthcare.gov or through the Affordable Care Act process. If you're a resident of Nevada and you want to partake in that process, the only vehicle for you to do so is through Nevada Health Link, and you can get there through NevadaHealthLink.com. Going through an outside vendor, going through a different insurance company, consumers can still buy insurance plans. They don't have to buy plans from Nevada Health Link to meet the law's requirements, but then they don't have any accessibility to subsidies or co-insurance or any of the other benefits that come through working with NevadaHealthLink.com.
Important. That's a website that you really do want to visit. And there's a lot of information that you can find at NevadaHealthLink.com. I was there. That's a great website. I know they help you with enrollment. You talked about the in-person assistance, where you can sit down with somebody who can take you through the process and show you that it's not that difficult. They'll help you with it. So in-person assistance is available through the website. The subsidies that we talked about, there's also a calculator so that you can look at your income for your household and see, am I going to be able to get some help with my health insurance? We talked about navigator organizations that can assist you with that and that in-person assistance. There's a lot of good things on that website. Andres, we're talking about 2016 insurance coverage. 2016 is not that far away. Is this something that every person needs to do?
The Affordable Care Act has what they call certain mandates of participation. So anyone who is a citizen or who's in this country legally is required to have health insurance. Now, if someone already has health insurance through their job, or someone's already on Medicaid, or someone's already on Medicare, or someone already has, say, TRICARE or VA benefits, if you already have health insurance provided to you, then you don't need to worry about anything. Your plans will meet the qualifications or the criteria described for in the law. It is really for those individuals who do not have health insurance or are underinsured that need to participate in this to ensure they have a qualified health plan and are enrolled in the process. And in Nevada, the easiest way for them to do that is through NevadaHealthLink.com.
It's got all the information you need.
Absolutely. The plans are income-based, and there really is an option for a variety of different situations. I get questions all the time about, I don't make enough money. Well, when you have a system that's income-based, if you are less than 138% of the poverty level, then you're going to qualify for Medicaid, and that's the program that you're going to get, and you don't need to worry about it. Enrolling in Medicaid meets your criteria in the law. If you make more than 138 poverty level, but you don't think you make too much more, then you're going to still qualify for subsidies. So those individuals who are between 139% and 150% of federal poverty level, they're on the lower end of the spectrum, and so they get the most amount of help to cover their insurance costs. If you make more, there's going to be less help, but the plans are still going to be affordable for you. And there's also a cap on out-of-pocket expenses. So the Affordable Care Act set for Nevada that a consumer will not pay more than $6,250 a year in out-of-pocket expenses. And for a family, $12,500. So when you think about what the medical costs are and what people incur, if I break my arm and I have to go to the emergency room, that's going to cost me, somewhere between $10,000 and up. So to know that since I have health insurance, I'm not going to pay more than $6,250 for any medical needs that come up throughout my year provides me the peace of mind that I don't have to worry about getting into that financial debt or uncertainty if something were to happen to me or to my daughter or to my spouse.
Boy, and it adds up fast.
It does.
I've had friends who have been in an emergency situation just for a day or two, and it's tens of thousands of dollars very quickly.
Absolutely. Emergency room care is the most expensive type of care that we have, so we don't want to use it unless we have to. And if you have to, you want to make sure you're not going to go bankrupt as a result. Some
of the stuff that I'm familiar with too, Andres, that I was really excited about with the Affordable Care Act, pre-existing conditions are no longer an issue.
Absolutely. It's one of the main provisions in the Affordable Care Act that truly changed the way healthcare is operating in this country. Before, people used to be trapped in their health insurance plans or in their jobs because if they switched, they would no longer get covered for pre-existing conditions or illnesses they had, and it was too expensive for them to pay for it on their own. With the Affordable Care Act, you can no longer be discriminated for having a pre-existing condition, which means you can switch jobs or you can switch plans and not be punished as a result of doing so. That is a great concept that was enacted as a part of the Affordable Care Act.
Andres Ramirez is with us today. We're talking about all the great things that you can access with Nevada HealthLink. Now, I want to reemphasize who needs to do something about this. If you are like me, working for a company like Beasley Media Group, we have company insurance. We're going through our own enrollment process with that insurance right now. If you have private insurance through your company, if you have Medicare, Medicaid, VA, any of that, you don't need to worry about this. But the kind of people that we really need to have get onto Nevada HealthLink for their 2016 coverage.
Any American who does not have health insurance or is underinsured, or any legal resident who's here who does not have health insurance, they need to enroll to make sure they comply with the law's requirements.
It's not that hard, and you can start at NevadaHealthLink.com.
Absolutely. One of the other great things about the Affordable Care Act and participating with this process, and you find a lot of these frequently asked questions and provisions at NevadaHealthLink.com, is some of these services that are now included in your health plan, which weren't necessarily included before, referred to now as preventive services. So now if you go get your annual checkup, which for often lots of people, that's really all they care about doing once a year, that annual checkup now is free of cost. It's included in your insurance. And so you can go to the doctor and you can get an annual checkup to make sure that there's nothing serious going on. If you're trying to get a flu shot or you're trying to do any of these preventive services for women, if they want to get mammograms, all of those things now are covered and they're free. And they're meant to ensure that you're taking care of yourself so that you're avoiding getting sick and where you now require the most expensive forms of care. If medical professionals can detect things ahead of time or early on, oftentimes they can treat them to prevent them from worsening. So these preventive services that are now included in qualified health plans as a result of the Affordable Care Act are another wonderful thing that many consumers take pride in once they enroll.
So much better. I never love a mammogram. And like you were talking about, flu shots, the kind of things that we should be doing in the wintertime to prevent a more serious, far more expensive illness. So we all need to get signed up, make sure everybody's covered with our insurance plan for 2016. Deadline dates, what are we dealing with there?
One of the fascinating things about the Affordable Care Act for the first few years is that the enrollment periods have changed each year. And so we have to continuously remind consumers and educate them about what their enrollment is. Now, for every consumer, whether you're in private insurance on the Affordable Care Act, they know they have to enroll every year. Enroll in insurance is an annual basis. But when you're dealing with a population who hasn't been insured before, all of it is brand new from the start. So this year, the enrollment dates, November 15th was the first day that was a kickoff for open enrollment, and it closes January 31st. Those are the dates that people have to enroll. And if you want your coverage to begin January 1st, then you need to enroll by December 15th. And the process essentially goes that if you want your coverage to begin at the beginning of the month, then you need to have enrolled and paid for your plan by the 15th of the previous month. If you enroll after December 15th, your plan will begin on February 1st. So you'll miss that first month of the year of coverage. It's important for people to understand that. A key critical deadline is coming up. December 15th means they will start off the year January 1 in compliance in a new plan that meets the criteria of the law with NevadaHealthLink.com.
So December 15th is an important date to keep in mind because that would get everything kicking in on January 1st, 2016. New start, new year, coverage, you're good.
Absolutely.
What if they just go, hey, I'm too busy, I'm not going to worry about this? If you don't sign up, what could happen?
For people who are required to participate, right? We've already talked about who's required to participate. If they choose not to, for whatever reason, they will be assessed a penalty, a tax penalty of $695 for that year for themselves. And if they live in a family or in a household, $695 per member of that household. That's over 18, and then it's half the fee for children that are under 18. So the fee can add up quite a bit. And if you take what the average lowest plan is on the bronze tier, which is the least expensive plans on the exchange, and you add that up over the course of the year, you can find a bronze plan for approximately $700 a year. And so your tax penalty, you would be paying it when you could have paid and had insurance. If you're going to pay the same amount of money, I'd rather have insurance than not have insurance, especially because now I know that all my preventive services are included and they're free. And, you know, if something unfortunate were to happen that I have to go to the emergency room, I also know I have insurance to cover me and not have to to worry about racking up a huge bill with the hospital.
We're talking with Andres Ramirez discussing Nevada HealthLink and quite possibly your insurance coverage for 2016. Not that scary of a topic. Once you sit down and you start really looking at it, what you were saying about that bronze level plan, the simplest basic plan, $700-ish for coverage like that. But also through Nevada HealthLink, you can use that calculator. They call it the subsidies calculator. Put in income in your household. You might actually be able to get subsidies that would help you cover that cost. Is that right?
Absolutely. And again, the premiums are based on the consumer's income. Let's say, for example, that there is a plan that on the open market would cost $500. Right? So if you buy that plan on the open market, you're going to pay $500. But on the HealthLink, depending on your income, you could get subsidies that would reduce that to, say, $200 or reduce it to $300 based on your income. And on some cases, in some plans, I mean, you have people who are able to cover the entire cost of the plan they choose or significantly reduce it to less than $100. It really just depends on the consumer, their income, and the type of coverage they're looking for themselves or their family. But one of the things I do want to emphasize that happens often is that a consumer will go onto NevadaHealthLink.com or they'll go onto healthcare.gov. They'll take a quick glance at what plans are available and they get sticker shock. And it's important to note that that's what the market value of those premiums are. They don't show you what you pay until you complete the application because they don't know what you're going to qualify for until you complete the application. So your subsidy, and if you qualify for cost sharing reductions, could reduce that fee or that price for that plan substantially. So it's important for them to go through the whole process to really know what their cost is going to be and not just look at the cost right up front when they start looking at prices for plans.
Also important is knowing that you need to go through NevadaHealthLink.com if you're going to get those subsidies to help you with the cost of your insurance. Because if you don't go through NevadaHealthLink.com, you don't have access to that.
Absolutely.
The bottom line of what we're talking about today is that insurance coverage for 2016 shouldn't be that difficult. Start on NevadaHealthLink.com. That'll give you a good overview. Be able to look at that subsidies calculator, put in your income, find out what you might be looking at. Better yet, find out where you can get some in-person assistance. Someone who does this all the time and is well-trained in your insurance coverage can help guide you through it and get you enrolled.
Absolutely. And what's critically important about the in-person assistance tool and even calling Nevada HealthLink, their hotline, is they can match you up with the situation that works best for you. It may be more convenient for you to find a broker or in-person assistance closest to your workplace. That just may be what's easier for you, or closest to your home, and that may be what's easiest. They can tell you which agents can help you at your geographic location. In addition, maybe you prefer to speak to someone in Spanish or speak to someone in Tagalog. They can tell you, here are the agents and in-person assistance operators who can help you in that preferred language. They can sort it to you by zip code, they can sort it to you by language. So for a lot of those things that someone needs help with or wants to communicate with them in a particular language, Nevada HealthLink can help you with that process. There's no reason for a consumer to feel overwhelmed or intimidated by the process. We have hundreds of licensed professionals in the state of Nevada that can help them through this process.
It's NevadaHealthLink.com. Andres Ramirez is with us today. You're simplifying everything, and this makes it so much easier because it could be overwhelming. If you think about, for instance, going out and finding a car, there's a lot of different cars, a lot of different makes, a lot of different models, years, mileage, everything, accessories and options. Health plans can be looked at in a similar fashion. There's a lot of different plans out there. It's not that hard to find the option that fits you best.
Correct. And one of the new benefits of the Affordable Care Act as well that I think is wonderful, we often get asked, what about young people and the so-called millennials and how do they get insured? Well, the Affordable Care Act also enacted a provision that allows individuals to stay on their parents' insurance until their 26th birthday. They may be in college, they may have graduated from college, they could even be married, and they can still stay on their parents' insurance until they turn 26 years old. So for a lot of young people who aren't sure whether they want to deal with this on their own, they can talk to their parents transfer, they can get their own plan. But that's a new benefit oftentimes that you have as parents who are researching health insurance options for their kids, even when they're in college. And so this now gives them greater peace of mind to know that, hey, I can continue to provide insurance for my family and my children until the age of 25.
A lot of interesting things are part of the Affordable Care Act. Of course, I got all excited about the no pre-existing conditions. I like that. Things like mammograms, the annual checkups, the flu shots, important things that we need ongoing now are covered automatically.
Mm-hmm.
And what you just mentioned about the fact that parents can keep their kids on until 26.
Correct.
Are people coming out of the woodwork saying that they need some help in figuring this out?
We have a call center that takes calls on a daily basis. We have hundreds of brokers and agents who are out there helping consumers. We have dozens of navigators who are helping people throughout the state. We're very happy about where we are in the process and the fact that we're able to help so many consumers. But we want to make sure they know that we're available. And if you're someone who wants more information or needs help understanding the process or even help enrolling, maybe you don't have access to the internet at your home, or maybe you just have a fear of computer like some people do. There are individuals who will fill out the application for you, complete it, make sure it's completed accurately and submitted accurately so that you are insured and don't have to worry about this moving into the new year.
Fairly short process, only take a few minutes to sit down and maybe go over that?
That's a great question, and it depends on the consumer.
Sure.
If the consumer's prepared and has all the information they need to complete the application, some folks can complete the application in as little as 20 minutes. Now, sometimes we have consumers that show up and they don't have all of the information they need, whether that is personal information for a spouse or for children, that they just didn't bring the information with them to complete the application, or maybe they're not sure of what doctor or physician they want to select to provide them treatment, so they'll take them a few days for them to figure it out. So we generally ask consumers to try and be as proactive as possible about bringing the information they need. And when you call ahead of time and you talk to an in-person assistance provider, they can recommend to you, hey, here's what you're going to need to complete the application effectively, so that when they do show up to finally begin the application process, they don't have to wait an extensive amount of time. But I do want to put the caveat that we do have some large families. I personally enrolled a family of 10 people. And so a family of 10 people is going to take you much longer to enroll than an individual or a couple or a family of 3. It depends on the consumer, depends on the family, depends on how prepared they are. But typically for someone who's prepared, your average person or your average family takes somewhere between 20 to 35 minutes.
We all have different requirements and expectations as far as what we want out of our health coverage. It's not a cookie cutter kind of situation for anyone. It's going to vary as far as what health plan you're going to go with, deductibles and copays, and a lot of different choices. Every family, every person is different, but there's something through Nevada Health Link that works for everyone.
Absolutely. And we notice that if a family comes, the husband generally, when he's looking at plans and looking at the option, just wants the affordable option. The mom in the family generally wants to make sure that the plan includes her OBGYN, and that's her priority in choosing a plan. And then her second priority is, does it cover their pediatrician? Those are generally the types of questions that we get and we see whether a family is ready to make the determination. Father's looking at the cost. Mom is looking at OBGYN and pediatricians, and then they make sure a plan can meet all those particular requirements. And once they reconcile that as a family, then they pick a plan.
That sounds a little complicated, but it actually isn't. It's just a process.
It's just a process. And again, it wouldn't be complicated when you're dealing with a licensed professional, because they know how to look up a plan and see whether your provider and your doctor or your specialist or your OBGYN or your pediatrician is provided for in that plan, so that you can make an educated decision. And from our perspective, we want consumers to be aware of those things so that we can give them the best plan for them.
Everything starts from the website, NevadaHealthLink.com, or Andres Ramirez, you mentioned calling. Call and ask and make sure that they have the right documentation and the right information when they come see someone in person. What number do they call?
That number is 855-7NV-LINK. That's 855-7NV-LINK.
I wrote that down. I'm going to also make sure that that's included on our Talking Solutions Facebook page, where we will also have a link to the interview. It will be available for you there. Phone number is 855-7NV-LINK. 855-7NV-LINK. The website, as we've mentioned a number of times today, NevadaHealthLink.com. And as far as the dates that we're talking about, Andres, you're saying if you want to have a plan that starts on January 1st, you need to be signed up by December 15th.
That is the deadline for insurance to begin January 1st. It's not the last day people have to enroll, but it is a critical deadline for people to avoid having any lapse in coverage through the calendar year.
That would be good. Someday I'll tell you the story about how I had a one-day lapse in car insurance back when I was a teenager, and that was not a good situation. Other things that people might want to keep in mind, if you're not dealing directly with Nevada HealthLink and you're talking to maybe a different kind of broker, they should have an ID card of some sort that has their photo, their name, Nevada HealthLink at the top, an official ID. Make sure. If you want to get the subsidies that will help make your insurance coverage even more affordable, you need to go through NevadaHealthLink.com to get access to those, yes?
Yes, absolutely.
And the people who don't have to worry about signing up through Nevada HealthLink for this, anyone who's on Medicare, Medicaid, workplace insurance, through the VA on their insurance plans, things like that, deal with that directly with whomever provides you with your insurance. But if you need insurance, NevadaHealthLink.com.
Yes. Thank
Are
you.
we starting to figure this out, Andres, a few years into the Affordable Care Act?
We're certainly seeing that more people are familiar with the process and they understand the importance of the process. And obviously at the end of this enrollment, we'll see whether in fact more people actually enrolled or not. But we're optimistic and we're hopeful that the previous work we've done over the past couple of years has laid a good foundation for us to continue to increase enrollment and be successful in these efforts.
The Affordable Care Act, people need to have insurance coverage. That's important because it could impact you in the way of a tax penalty. But the exciting thing is, it really is not going to cost you that much. There's a lot of preventative medical procedures, annual checkups for those flu shots, for those mammograms, things of that nature, all covered. So it's a good thing, and Nevada HealthLink can help us.
Yes.
We can do this. NevadaHealthLink.com. Phone number is 855. The number is 7NV-LINK, 855-7NV-LINK. Andres Ramirez, it's not that difficult.
It's not that difficult because Nevada HealthLink and the Silver State Health Insurance Exchange has put together a process to help consumers successfully enroll and get through this. We're thankful for having a wonderful partner and an agency in this state that's so committed to helping consumers. Because without them and without all the work they've put together, it could be daunting and it could be overwhelming. But Nevadans don't have to worry about that because we have a great agency and a partner that's ensuring they provide the support and assistance people need.
And not all states provide this, is that right?
Yes, not all states are participating.
We are lucky to live here. This is a good thing. This is the benefit for living here in the Silver State is we have Nevada HealthLink, and it's here to help us. Andres Ramirez, it's great for you to come in. It makes everybody feel better about getting that insurance coverage. Again, if you want to start 2016 on January 1st with health coverage in place, you need to make sure that you're signed up by December 15th. Now, that doesn't mean that down the road you can't get coverage, but if you want to start out the new year, which is a great time to get it kicked off, December 15th, not that far away, we should do that.
Yes.
NevadaHealthLink.com. Everything you need is right there. Andres Ramirez, I feel clear on this now.
Terry, I'm glad I could be here and I'm glad I can answer questions and help. That is our aim in this process, to ensure that we can demystify the process and explain it in simple terms for people to feel better about wanting to participate.
You make it easy, and we thank you so much for joining us today on Talking Solutions.
Thank you for having me.